Does everyone know what speaker they're analyzing? Just make sure. Okay.
Good afternoon, ladies and gentlemen. My name is PersuasiveSpeech, and I want to present you my speech. As you probably know, nowadays personal appearance plays a very important role in people's life, and many people search for different methods to make their bodies more attractive. And unfortunately, most of these methods are harmful for our health. And one of them is cosmetic surgery, and many people use it. In fact, according to Cosmetic Surgery Care News, in 2008, there was in British companies such as Harvey Medical Group, they reported that there was a rise of cosmetic surgery demand of 35% in that year. What's interesting is that year it was a credit crunch, and even it did not affect the rise of this procedure, and it costs not, the price is not low. So let's begin. I decided to begin with one of the researchers in Rio de Janeiro. The information from this research was written by Daniel Donald Andre. And Brazil actually is the second high rate in cosmetic procedures such as this. And in this research took place 12 plastic surgeons, 15 patients, and 10 experts in psychology and psychotherapy in order to determine how these operations react on people, not only on their physical health, but also to the psychological health. Most participants said they decided to undergo this procedure because they wanted to be normal. This was their words. In my opinion, every people is normal, but actually, if they really face lots of difficulties and suffering because of their own bodies, it's okay to do it. But during the interview, one of them said that say the following words: "I do it to boost my self-esteem and to feel a sense of joy again." This woman was 73 years old, and she made a facelift in order to delete her wrinkles from her face. Actually, I'm not an expert, but I think that it's okay if a woman at 73 years have wrinkles. But they say that they want to be normal, they want to be normal, but it seems like she did this operation in order to look strange, because for 73 years old woman is a pig who has wrinkles. And she supported it because she wants to feel a sense of joy. Feel the sense of joy at 73 years old is also very strange, but actually I think that all people should understand that personal appearance is not the most important thing in our life, and I think that if you can avoid the cosmetic surgery, you should avoid it because of the following risks and post-operative complications which may happen during the procedure. And I think that it's not good to risk your health in order to look crazy. Here you can see that even this can be not just a complication, but tragedy after the procedure. And this was presented by Jennifer Haslund, author of this journal. So, as it was understood during this research, all people are not the only ones who want to feel the joy, sense of joy. I mean, because teenagers also undergo these operations very often, and it was argued by Sociedade Brasileira de Cirurgia Plástica that for the last 10 years the number of demands from teenagers raised from 5% to 15% of the all of this type of procedures. What is more, many of these teenagers use this operation in order to reduce their obesity, to reduce their weight. But there are lots of other ways to do it, for example, physical training, diet, and I think that just for this reason is not also, we should not risk our health just to reduce our weight. There are other methods to do it. And by the end of this research, all surgeons were against the use of these operations on children, and 50% of them were strongly against, and the other half were saying that they should be used only in cases of strong asymmetries and very high level of suffering, psychological suffering. For example, very big nose or something from what people suffer too much. But in other cases, it's not a good idea to risk your life, and it leads to a clear contradiction between individual expression and social pressure to conform to certain beauty standards. And people who do it because of the second reason, it's okay to do it, in my opinion. But nevertheless, they should understand that there may be some perioperative and postoperative complications. What about the first individual expressions? The best example for this is breast implant. Yes, I also think that this is not because of the social pressure. I think that women do it because they want to feel the sense of joy, as it was said before. And it was written in this journal by Jack Willis Sanchez Taylor that 800 women each year in UK demand this type of procedure. And it's also harmful, and this can be supported by the following list of difficulties, risks, and complications which may also happen, and written by Walter Eckhart. And actually, the risk is very low, and this can be resolved by the second operation, for example. But if people make too much operations at one time, this may lead to more complications. For example, it was argued in this research by psychologists that many teenagers who undergone this operation decided that they did not cure it fully, and they decided to do it again and again, and they didn't want to stop. It looks like a lottery, but in the lottery people earn money, and here they spend money in order to reduce the health quality. I think it's not logic. So here you can see the reference list. It's not interesting. By the end of, in conclusion, I want to say that I believe and I wish that you realize that all the risks and possibilities that may happen during these procedures, and that this affects not only to our physical health, but also on psychological level. It was supported by the example with the lottery. And I wish that you agree with my opinion. Thank you for your attention. I should probably may I?
It should be,
I didn't know that we should bring it up.
okay, just leave it on the desk by the end of the day.
Спасибо.